Hi, my name is Morgan Stebbins. I'm a practical nursing student at Wilson State College. Today I'll be showing you how to do passive range of motion and how to do ambulation with your patient. So before I even enter the room, I check the chart and make sure my patient has no restrictions, and they do not. She is able to perform all range of motion today, and before I begin, I would do hand hygiene and then I'd verify with my patient. So I'm going to come over and I'm going to check her wristband, and then I'm going to ask for her date of birth and full name. So if everything's correct, then now I'll be moving to raising the bed up to a comfortable height that works for both. So I drop the new screen nose. And then we'll be coming over and only exposing. And then I'll be doing flexion and then extension. And then this is hyperextension. And then I will be doing abduction, adduction, and then I'll be doing internal rotation and external rotation. And then for the wrist, I'll be doing flexion, extension, and then this is supination, and then this is pronation. So once I've done that, and for video purposes, I will only be doing it one time, but you'd be doing it 5 to 10 times on both sides. But for today, I'll just be doing it one side, one time. So once I've done that, raise up my nails, make sure they're secure. So I'll be going down to the leg. And then I'll be doing flexion, extension, and then I'll be doing abduction and abduction. And usually you cross the midline. And then I'm going to be doing internal rotation and external rotation. And then once I've done that, then I will pull the blanket down the patient so it's easier for us. And then I'll have my assistant come over and we'll be sliding the patient up. So before I do that, I'm going to be moving the pillow so my patient's head does not hit the headboard. And then if my patient was able to, I'd ask them to bend their knees and hold their arms like this. So we'll be rolling this. And then we're going to have our one foot pointed in the direction we're going and the one like this. And we're going to be squatting. And then on the count of 3, we're going to be moving her up. So 1, 2, 3. And then once she's moved up, then I can fix her pillow so she's comfortable. And then after this, then I will be doing rotation so I can put her pillows to adjust her. So I'll be turning her towards my assistant. So like that. Let's see if we have any. And then I'll be placing one under the legs, and then we'll be rolling her back over. And then I'd have one in between her arms, and I'd be untucking her shoulder as well to make sure there's no pressure. And then make sure she'd be facing this way, like lateral. So once my patient's in this position, then I will be grabbing my pillows and we'll be going into supine. So make sure her pillow's correct, and then make sure she's laying straight, and then I would place a pillow under her arms. Oh, and then I'll be grabbing this one under her back. So let me grab these. And 1, 2, 3. Thank you, Michelle. Okay, so then I'd be placing them under her legs, making sure no pressure on her feet. And now I'd be placing them under both arms. And then once my patient is like this, I provide privacy, see how they're doing. My patient's doing good. So once they've done this, then I can take my pillows out and we will put them in high Fowler's position. So we're going to be moving them up. Okay, so usually it'd be as high as the bed can go at a 90-degree angle, and then we'll be moving the bed down. So then what I would do for my patient, we're gonna have my assistant Michelle be my patient and she'll come sit, but usually I'd have the gait belt and help move my patient this way. So Michelle's gonna come sit over here, and I put my grippies on Michelle, but Michelle has shoes on, so I'll just be putting them on the patient. And then I bring my wheelchair over and lock, and then I let her feet dangle for 1 to 3 minutes. Make sure she's feeling okay. Are you feeling dizzy or nauseous or anything? Okay, perfect. So when she's over, then I'm just gonna get my gait belt ready. Oops, sorry. And I'm just gonna, and then I'd be making sure this is under the bust line with about 3 inches or 3 fingers of wiggle room. So about 3 fingers, so I'll just tighten that a little bit more. And then we're gonna have our toes pointed. And so I'm gonna be moving you in this, so when you feel the back of the chair, you can just sit down, okay? And you'll be grabbing right here on my arms. And I'll count on 3, okay? So ready, 1, 2, 3. And then we'll just be shuffling over to the chair. And then once you feel the back, you can just scoot back. And then once you feel it, we'll sit down. Then perfect. Are you doing okay? Okay, perfect. So once we're here, now we'll go to ambulation. So do you feel okay to do a couple steps? Okay, perfect. So what we're gonna do is we're gonna do the same exact thing. So we're gonna go 1, 2, and 3. And then I come around to the side. Then we'll do a couple steps. And then we're gonna turn. And then do you wanna sit in the chair or the bed?
The chair is fine.
Okay, so then we'll do a little turn, then sit down. And then I would ask my patient if she wants to stay in her wheelchair or if she would like to go back in bed. I'd see if she may want anything, if she's doing okay, if she's dizzy, if she's nauseous. I provide privacy and I chart and make sure, and then I perform hand hygiene. Thank you.